Hello, I want to talk to you today how we can apply statistics to our clinical work. Of course, as doctors or surgeons, you want to apply science. So we want to look at studies that have been published and see if they may be valuable to our work, but also we want to present our work to our colleagues, get it published. So how can we do it? It can be quite bewildering because you can be overwhelmed by statistical methods. Here's my input. Here are the different studies that you'll see mentioned. So there's case report. Well, all the statisticians and epidemiologists say there's poor, worthless. But a single case report of a new operation or a new disease or a new complication can be a major breakthrough. Don't deny its values. The first case report, the case report of thalidomide side effects by Dr. McBride in the 60s saves thousands of people from the complications from that disease as a simple letter to the journal. Case report can be valuable. Also, a case report the first time a new operation has been done. These are valuable. Case series means, multiple case reports put together, usually by one doctor, one clinician, one surgeon. Again, the statisticians say they're poor, but I think they're quite good, and I actually like a case series from a respected colleague or clinician. You can visit their hospital or talk to the colleagues, see if they are respected and how trustworthy their reporting is. Cross-sectional studies, statistical term, it's looking at disease and time, its prevalence. Cohort controls, looking at disease, how it progresses across time. Controlled study where you have one group that's affected, another group that's not affected. They can be useful, a little bit difficult to do. RCT, randomized controlled trials, we've got to all bow down and worship this. This is a gold standard that all the epidemiologists and journals want. But know what? It's unrealistic. It's huge studies, very, very expensive, beyond the resources of an individual, hospital, university, and they're very slow and difficult to perform logistically. So you're really giving over all research to drug companies. Can you really believe what's going to be reported back to you? So it's rather naive to think that these are the gold standards and are the only way to proceed. So take it with a grain of salt, these RCTs. Now, placebo surgery, that's where a lot of operations reported being beneficial. Maybe we need to look at this concept. This highly regarded surgeon has pointed out surgery, the ultimate placebo, and he's promoted placebo surgery. However, with respect, I disagree with placebo surgery. First of all, there's certain ethics issues, and do you really think that patients can be fooled that they've had an operation when in fact they haven't? Taken them to the operating room, given an anaesthetic, make an incision. Patients aren't fools. They know whether they've had the operation or not. They're not going to be fooled. Now, there's another one here, meta-analysis. This is something that gets a lot of papers published, but in fact it's lazy science. You get all the papers that are pro something, show some operation or some drug beneficial, versus the ones that are against it. Weigh them up, positive versus negative, and report it. Why don't you go and do your own case report, case series? It's really lazy. And now there's another technique called the Power of One. It's reported in the New York Times about a year ago, and I'll just explain a little further. Here it is simply described. So you take an individual patient, there's an intervention, a drug or an operation or procedure, and then there's an outcome. So the patient is their own control. You measure all the parameters here, you measure, all the parameters here you measure, and see what the difference is. So this has got a lot of potency, should be looked at more carefully. In summary, statistics are important. We need to apply science to our work, but don't allow ourselves to be overwhelmed and intimidated by epidemiologists and statisticians. Case reports, case series are valuable. RCTs, take it with a grain of salt. Meta-analysis, avoid. It's just lazy. Look at this new potential system. Good luck with your work, and always try to apply science to your clinical work.